In mothers who are desiring to undergo IVF therapy, knowing this whole Zika crisis that I would quote, I think it's important for us to be a little cautious. And I would like to quote the statement of Dick Cheney about the knowns and the unknowns. And I think we're right there, in which there's a lot of stuff that we don't know about the Zika in terms of its infectivity, at what point in the pregnancy, whether it's during the period of organogenesis early on or later on, as I mentioned, does this have serious fetal implication? So I think, having said that, I think individuals have to look at this simplistically. Meaning, ma'am, would you like to take the risk of having a baby affected by the Zika virus? Significant neurologic insult? And I'm sure the answer is going to be no. I want to go through IVF. I want to have a healthy child. So I think until we understand the Zika disease better in mothers who are pregnant, I would say avoid flying to areas where there's a high epidemic of Zika infection. And until then, use the universal precaution that we all talk about. If you really have to go to the area because there's a family emergency, then use universal precaution. That's my advice. Now, the good news is not all mothers who get bit by the mosquito are going to get a Zika infected fetus. And the number has been rather broad. People tell you it's maybe about less than 0.05%. Some people will tell you it's about 0.1% or 1%. But I think, and of course the latest data came out that said it could be as high as 13%, which I really doubt. I don't think it's 13%. So I think that's a blessing. But I think those are all statistical numbers, meaning someone is going to be that 0.1% or 0.05%. So I think using judgment call is crucial, especially in mothers who are in the reproductive age group or want to undergo IVF therapy or who are pregnant. If you can avoid a region which has a high prevalence of Zika, then I think you should. Then I think until we know better, I think if a physician told her 2 months, as per the infertility specialist, I think that's a reasonable period of time. It's either 2 months or you're stuck with the long-term implication of a fetus with severe neurologic insult, right? It may sound crude, but I think 2 months is nothing. And I think waiting 2 months is not going to make much of a difference in terms of your IVF process. It's not that we are going to physiologically change in 2 months. So I think it's a reasonable thing to do, waiting for 2 months before you proceed with the cycle.